Hello, I'm Ray Jones from Plymouth University, and this short video is one in a series for the Health App Challenge. And this particular video raises a question. We want to try and get your responses really about the roles of hackathons and app challenges. What role do they have? How can we sustain the apps developed from hackathons and app challenges? So listen to this and think about it. Probably by watching this video you already know what a hackathon is, but in case you didn't know, a hackathon's where various people would get together in maybe at a side show to a conference or some other place. You get developers, you get patients, you get clinicians all together, and they turn up the ideas and then try and develop them over a period of a few days, and they're quite popular. But I mean, here we see in this website somebody saying, well, the main achievement maybe not the apps which are developed, and he actually says that few are commercialized and maintained. In which case, why do we bother? Be interested to know if you know of some apps developed from hackathons which are currently being used. The app challenge idea is something that we tried in 2012 with the Diabetes App Challenge, and which is what we're doing now with the Health App Challenge. In 2012, we got patients and their teams to young people with diabetes to develop 6 different apps. They're shown on the screen here. So we had 2 that logged information, Diabetes Logger and Health Tracker. We had 2 which helped in calculate the insulin dose that you might need, Insulin Calc and CP Slider, and we had 2 that helped you to prepare for a consultation. But none of these apps were really maintained after the app challenge finished, even though they got good reviews by our reviewers. So how can we sustain apps? And if not, what happens to the work, the intellectual property that's been invested in those apps? So we wonder whether charities have a role. Do charities have a role? Could they help take apps through to commercialization for the benefit of that patient community? If that's not possible, what about maintaining a list at least of hackathon app challenge apps, even if they're not maintained, but at least so the idea is kept? Or should we just leave these things to disseminate to the people who see them at the time and then die? What do you think?